So guys, today we're going to look at treatment for tennis elbow. And so you've already watched bollocks, I think I've got tennis elbow. And so here's the treatment. So if we start with loading first, so you can use a band if you have one, or a small dumbbell. So you want to work on wrist extension. So with a band like so, okay, I'm working on extension. So you'd be better off resting your forearm on the table or even on your knee. So if we come down here, so I'm resting it on my knee. I'm trying to go through a full range of movement. Yeah. So wrist extension, you can do it isometrically. So here, and use your other hand as resistance, so the muscle is lengthening, or the muscle is contracting but not lengthening and shortening, so isometric. And then you got supination, which is going from here to here, so turn your palm up. So again with a band, and you're just pulling and then down. Yeah, and again you could attach it to the door, so here and here. Yeah. So if I had it attached to the door, and then I could even step out and then supinate. Yeah. So you want minimum pain, no more than 3 out of 10 reps and sets as able, and just progressively either increase the weight that you're using, or the band, or do more reps, and doing it every day. And then you got so some soft tissue release. Yeah, so you can come in with your other forearm. Yeah, so stick a bit of oil there, any kind of oil, even olive oil would work, and you're just coming in and trying to release all that tension. Yeah, so again, brace your foot on your knee and just come in, or put your arm on the table and just try to release, because again, as we discussed in the other video, it's these flexor or extensor digitorums, the muscles along here that get tight. You can also use a ball to do what we trigger point. So if you look at one of my previous videos on arm mobilization, so getting a ball in there to release it. So you tack and twist, so tack the ball down, twist to take up the skin, and then you kind of move the arm around. And you want it to be uncomfortable. Soft tissue work is supposed to be uncomfortable, so you want to smash into it as much as you can. Yeah, and then you can come along down on the forearm with the ball, tack, twist, release. Yeah, and then you can also rub the ball. So get your arm on the table and rub that ball up along. Again, you might find it more comfortable, well, easier just to use your opposite forearm, or you get your partner or a friend to smash into it for you. And then you can get what we call an epicondylar clasp. Yeah, the clasp over it. You can get one of your pharmacy, just go in, ask your pharmacist, you've got tennis elbow and you want a clasp. He'll find you the right one. So it needs to go right tight just below the elbow joint, and that can give you some relief. And then you can do last two things. So you can do Voodoo Wrap. So you can buy Voodoo Wraps. This is actually a bicycle inner tube that I've just took the nozzle off and wrapped it up and cut down the middle of it. So it's essentially the same thing. So you want to wrap the elbow nice and tight. So if we come in here, so a little bit difficult to do it on your own, but I'm sure we'll get there. So again, and you want to go at about an inch overlap. The bike tube actually works quite well if you've got a spare bike tube around. The Voodoo Wraps are only a couple of quid. And then you want to tuck it in. Yeah, so this is going to gap the elbow as well. And then you want to come into so you're coming into flexion. Yeah. You can turn your hand around. And then you can come into extension. So put your hand either, you could even do it on the wall or on a table in front of you. Yeah. And then you can come in and just grab the muscle and pull it across. Obviously that's supposed to be tied in there, but it's coming loose on me. Yeah. So you can just kind of grab that muscle and trying to pull it across. So you're pulling across. You can see him grabbing the muscle there. Yeah. And again, about 2 to 3 minutes. You might start getting a little bit of discoloration. You can see it in my hands there. This one's nice and red. You get one hand that goes a bit zombie-like. Again, just be cautious. And then just pop it off again. And what you'll find is that resisted movement is probably going to be a lot less painful. And then probably one of the more important things is you want to try to reduce what the aggravating factors are. So if you're on a computer all day, and I know we obviously have to work, but if you can modify that in any way, get one of those voice activated keyboards or typer thingies, whatever they're fucking called. And if you're doing a lot of screwing, using tools with your affected hand, you might try to get better at using the other hand. You'll find even like probably people who are, say, had 2 weeks off over the Christmas, their tennis elbow is probably significantly better with that just rest. But yeah, if you keep aggravating it, it's going to take a lot longer to heal. Worst case scenarios, people sometimes get steroid injections. And I've even heard of people having surgery, but again, that's very rare. But you want to avoid that if at all possible. And again, like I've said in most of my videos, see a therapist. He'll have a look at joints above and below. Maybe there's something going on with the wrist or the shoulder. He'll make sure that it is a true tennis elbow. Things like acupuncture can work quite well as well. Yeah, so comment, like, and share. And we'll catch you soon. Bye.